Hello, lovely. How are you? Good. Nice to meet you. I'm Dr. Nicola, one of the dermatologists here. Now, tell me, what are your concerns with your skin? Mm-hmm. Okay. Yeah, I can see what you mean. Mm-hmm. Yeah. Yeah, I can see that. Okay, I mean, just by looking, I can see that your face looks a little bit dull, a little bit uneven. Alright, I can see some dark circles there. Not excessive, but I can see. And yeah, if I have a look, I can see those blackheads that you're concerned about. Alright, now what I'm going to do is just have a good look at your skin, okay, and see what's going on. And then I'm going to have a look with my magnifying glass and my light, okay. Then I'm going to get on some gloves and I'm going to have a good feel of your skin. Alright, you're welcome. So for now, if you could just sit with no expression. Okay. Close your eyes. You can open. Can you just tilt your head back? Okay, and back. Now, if I could get you to smile for me. Okay, now big smile and show me your teeth. Don't worry, I'm not assessing your teeth. Good. Now, can you raise your brows? Frown. Okay, relax. Have you ever suffered with acne or... Okay, so that's what the scarring is there. Okay. No, it's not excessive, but I can see that there's been some kind of, breakout going on the cheek area, definitely more than just one. Some of them are looking a little bit deeper than others, but I need to have a little bit of a closer look. Okay, and by looking at your nose, I can definitely see all those blackheads that are concerning you. Now, your pores are quite enlarged, so I can really see what's going on there. And same with your chin. Okay, you don't really have much in the way of large pores on your chin, but I can definitely see some blackheads. Okay. So I'm just going to bring in my light, my love, okay? So it will be bright, so you may wish to close your eyes. Okay. Yeah. Okay. Let's bring in my magnifying glass. Okay. Yeah, it's interesting. I can see the blackheads. You can definitely see them a lot clearer. You can see how quite deep some of them are. Okay, I can definitely see the scarring as well that we were talking about. Okay, I'm going to bring in my light as well. Right, okay. I'm going to pop on my gloves, okay? Okay, am I right to touch your face? Thank you. Just feeling your forehead feels quite smooth, quite easy to move. There's no restriction there. And see all the scarring here. Some look quite pitted, others not so much. To touch, it does feel quite smooth. Nothing really obvious on the surface, so I would say this is quite some time ago. Yeah. You can see the discoloration around it and where it's still quite red and more deep, like you can tell that's where you had your breakouts. Okay. Definitely the same side. Let's just feel. Yeah, it feels the same. You do have some fine lines just here and out slightly, a bit like roots. Okay, and they're not deep set, okay, and they're not typical crow's feet, they're more kind of here and out like that. Okay. But I take you smile a lot, which is good. Okay. And then your dark circle. It's more kind of here and just there a little bit, but you're quite hollow there. It's quite shallow, should I say. It makes the hollowing effect, and then it can have more of that reflection, which is quite annoying, but yeah, I can't feel or see any puffiness. Okay, now you do have fine line under there, okay, which is spreading to the sides, okay, yeah. There's only one and then two so far down in that, but it's not excessive, it's very common in that area here, can go quite like loses elasticity very quickly. It's very thin, very delicate area, and it gets thinner and thinner and loses its collagen, and it kind of starts to sort of sag a little bit, but then it kind of creases up, and that's when we end up with lines under our eyes. Yeah, it's very normal, very common. Yeah, I mean, even younger people have lines under their eyes. I mean, especially if you smile a lot or you're very expressive. Okay, we just need to keep hydrating under there as much as possible. Okay. Okay. You do have very similar lines cheeks are very similar. You can see the scarring, some more pitted than others. You can see the discoloration around it. Yeah, it does feel smooth to touch, just as the other side does, okay. We do have a little line here. Alright, sort of breaks off a little bit, similar to the other side. And then a bit of dark circle again, just here, very similar to the other side. And same with the under eye line, so it's very symmetrical, very even. Alright. Smile. So I can see the lines get more prominent upwards, like so. And then under the eyes, more lines appear, so it's quite scrunched up, several lines. Yeah, that's quite common when we are scrunching our face or smiling or, you know, doing expressions. So yeah, that's perfectly normal, my love. But not everybody likes that, and that is okay. It's about hydrating under our eyes, okay, as much as possible, and trying to get our collagen and our skin starts to rejuvenate, alright, and things. So there's products and things that we can do to help, okay. Obviously there is treatments that you can have done surgically, should I say non-surgically, but like, you know, polynucleotides under your eyes or Lumia or something like that, or you can have prefer all over your face, like a collagen booster. Alright, we can't put Botox, no, under the eyes, we can't do that, unfortunately. We can do around your crow's feet and so far in, but we can't do any further than that. Okay, yeah, and that's obviously going to stop your muscles contracting and moving, which can in turn prevent further wrinkles and fine lines because you're not moving it to get the creases in. But you still need to be using a good skincare if you do go down that route. Okay, that's where a lot of people get confused, like, why are you using skincare if you have Botox? They're two totally different things. Botox is working on your muscles, and filler fills things in. You're putting something in, and with the skincare we are trying to work on our layers of the skin. It's not just the outer epidermis. We want to go down and help go through to the dermis as much as possible. But obviously it's very difficult with obviously skincare. Obviously we need to be using high grade products and other treatments to help, okay, but I can go on about that a little bit later down the line. I just want to finish assessing first. So yeah, there's several different things you could use to help with that, okay. So I can see some blackheads there. No breakouts or anything like that, just a couple of blackheads. It doesn't typically feel oily either. Okay, which is good. Let me just have a look at your nose. Yeah, so there is quite a lot of blackhead on there. You've got quite a lot of enlarged pores. And I can see lots of the blackheads. I can see why that's bothering you quite a lot. I mean, your nose does feel a little bit on the greasy side. Okay, which is obviously why we've got these blackheads going on here. Between the brows a little bit there. Just And, your forehead is very hydrated. Do you drink a lot of water at all? Oh, fantastic, that's brilliant. Okay, so if you don't have any fine lines or wrinkles on your forehead, and you don't have any dehydration lines either, I can't see any pigmentation. There's no breakouts, nothing going on there at all really. It actually feels quite normal. Yeah, there's no pulling, no restriction or anything, and it doesn't look or appear shiny or greasy. Okay, so that's just your nose, and you know, your chin is obviously got blackheads, but not many of them, it's just a couple. But it's quite common to get breakouts and blackheads on your chin, especially if it's hormonal related. Okay, yeah, alright. And your cheeks, I mean, your cheeks are pretty normal. There's nothing really going on. Forget the scarring. Just in general, your skin here is very normal. There's no dry patches. It's not greasy, not oily. Very hydrated. Okay. Now, cheeks feel quite supple. Quite supple. Let's do forehead. That's quite supple as well. And okay. Okay, so you're not getting any redness or anything with me touching your face. So, you know, I wouldn't really say you've got sensitive skin. I mean, how are you with skincare and products? Okay. Right. Okay. So, your skin is quite youthful. Alright. The main part where I can see that you're aging is under your eyes. Okay. Yeah. That is the main area. Alright. So, the rest of your face, you don't have any fine lines or wrinkles, and you know, you do have quite a lot of bounce, good elasticity everywhere else. It's literally just under your eyes. So I'm just going to gently squeeze under your eyes, okay? Yeah, so it feels a little bit saggy, no umph with it, no bounce, okay? And it's just kind of crimpling up then, so it's not hydrated enough. But that's what happens when we lose collagen under your eyes. Okay, yeah, I mean, there's light therapy, which is fantastic. There's a great option for like blemishes, scarring, skin tone, texture, and things like that. It's really fantastic. And you can also have like an anti-aging one, which is great for like fine lines, wrinkles, and things like that. Yeah. So there's all sorts of different things. You can go to the salon to have it done, or in clinic. You can purchase ones at home. Some are not as good as others. And you know, if you use it daily on a set program, you know, you should start to see results within 8 weeks. Alright. Yeah, I think a light therapy would be great for you. I feel like working on a blemish setting first will be fantastic for you to help with the uneven texture, skin tone and discoloration, scarring and any little marks where you've had breakouts. Yeah, then I think the aging setting will be perfect to help with any fine lines and wrinkles and prevention, and then go into the sustain kind of one to keep your skin the same. And I would recommend the shark mask. Okay, yeah, it's fantastic, and you know, I'm always recommending it to people. Yeah, it's got quite good power and strength as well. Yeah, so what you would do with that is add it into your routine. Okay, so we need to be having a daytime and a nighttime routine, and then we use the mask once a day. Okay, yeah, exactly that. I feel that would be really beneficial for you. We need to make sure we are double cleansing, okay, with hyaluronic acid cleanser, maybe something with ceramides in, or clay or something like that, to help remove the impurities and obviously add hydration. Something like that will be good for you, especially because of your nose area. It is getting clogged, your pores are getting clogged, so we need to get that removed, okay? So we'll be doing you an extraction shortly, but I would just like to talk to you about the products and what I suggest first, okay? And then do the extraction just before you go. Okay, so I think that'll be really good for you. And you know, if you can regularly steam your face, whether you have like a warm shower and you know it's enclosed, to open up your pores so it can help draw out the impurities, double cleanse with a cleanser like I've suggested, good to clean around the second one, then exfoliate at least twice a week. Okay, anything really, you don't want anything too abrasive because it's going to be harsh on your skin. You know, something nice, and make sure you get all around your nose area, really give it a good scrub, and on your chin, and you know, make sure you do get your hairline as well. Okay, remove that. Then I would suggest the day that you do the exfoliation, use a sheet mask or a mask that you apply something like hyaluronic acid or a brightening one, so vitamin C, or if you would like to use something purifying, you know, you could do it to help obviously the breakouts and things. Okay, something like that, that'd be really good for you. Alright, and then you would need to be using some kind of serum, my love. Okay, if you are concerned about aging, definitely hyaluronic acid, something like that. Yeah, niacinamide. There's different products on the market, depends what kind of product you're looking at. Some products have multiple things in one, and then you can use that instead of probably loads of different serums on your face. Okay, then I would definitely suggest you using a form of retinol. Alright, that's going to help your cell reproduce, but you've got to use it gradually and work your way up, because your skin's going to overturn too quickly and then you're going to get a reaction and breakout and things like that. Okay, so you know, there's different types. Retin A, you've got a retinol, retinoid, and you know, you've got retinol and different levels of things, so it's just trial and error which is the best for you. You know, you've got tretinoin and things like that, but they're a lot more stronger and I would have to prescribe you that. But you know, maybe start on a weaker form and work your way up. I think that would be a better option. There's oxalic acid and different things that we could be using. I mean, there's a full list of different acids and things you can put on our face, but sometimes, you know, you don't want to be using everything, and it's, you know, maybe use something for a short period of time and then move on to something else. But a retinol you need to be putting on at night. Okay, try not to put anything else on with a retinol. Okay, yeah, obviously moisturise and things, but I mean no other serums. Okay, maybe do it like twice a week to start with and work your way up. Yeah, but it has to go on at night ideally, unless you get a product that has got some retinol in it and it suggests it's a day product. Okay, you can get like ones that you could have in the day that have got some like pre-retinol in it, and like it has hyaluronic acid a nice smile and different things like that. So, you know, and also having ceramides are really good for the skin. There's all sorts of different products. Then we need to be using an eye cream. Now, eye creams are essential, especially if you are concerned about your under eye. Alright, some eye creams can brighten, some can depuff, but you want something really nourishing and moisturising, especially for the night time. You like something nice and thick, but not necessarily for the day. Maybe go down the route of a serum or serum and a cream. It's just, you know, it's up to you on that. Okay, and then at night we want a nice thick moisturiser. That's really going to help lock in everything, okay? Yeah, and especially when you are using a retinol, you do want a really good moisturiser at night. Make sure you're using an SPF in the day. And in the morning routine, you'd want to use, say, hyaluronic acid and whatever, and a moisturiser for the day and things. You can mix and match with so many things. And it's about finding the right thing for you, the right brand for you, and the right mix of products. You know, you might want to use something for, say, 2 months and then want to swap a product in and do that again. I think that's fine. You need to find that right thing for you. And then when you're going to slot in your mask, your shark mask, for example, I would do double cleanse. Then I would do an exfoliator. Then I'd put on the shark mask. Once the shark mask is done, you'd then pop on some hypochlorous solution, something like that. Then you can pop on a sheet mask or a mask, then remove it. Then you're going to pop on your serums, eye creams, moisturiser. Okay, on the day that you aren't exfoliating and wearing a mask, you just do double cleanse, the mask, serums, eye creams, moisturiser. Does that make sense? Good. Once you're in the swing of things, you know, it should be quite easy to get, you know, a good balance. Alright, does that make sense to you? Okay. Yeah, you will do. The more that you kind of, you know, learn your skin and what needs doing to your skin, you know, the easier and quicker it will be for you. No, my love, you don't have bad skin at all. I think you actually have really nice skin, my love. Yeah, I mean, you know, you're fantastic, really. I mean, you don't really have, like I said, anything going on. It's quite good. Obviously, we need to get the oil production under control. Okay, so we definitely need to be popping something separate here. Maybe some new strips just to draw it out with hypochlorite in there, and it will pull them out. Like when you pop on your blemish patches, you can get a big one for the nose, and it will really help absorb that. So I definitely recommend that. Maybe Hero brand or something. You pop it on and then it peels them out. It helps relieve them, so that's a really good thing to be using. You can get certain wipes and things, but we don't want to be using anything that's too harsh. That's why I've suggested that patch, because it's not very harsh. Yeah, it's quite good and quite effective. Yeah, and same if you have any bright breakouts, something like that would be really good for you. Yeah. Do you have any questions about your skin, anything I've spoken about, or skincare or anything like that? Yeah, it's a lot of information, so don't worry, I will be writing this all up for you and sending it you over. Also with skincare recommendations, and obviously the shark mask I was telling you about, and I will pop on some other mask recommendations as well. And then obviously some recommendations for like sheet masks and all sorts of things like that, my love, okay? Yeah, and then obviously I can also tell you about, you know, certain under eye treatments if you wish to go down that route. Yeah, and then maybe like chemical peels, laser treatment. There's all sorts of different things that I can offer here in clinic. Whether you wanted, you know, some Botox around here, whether you wanted to do maybe like a filler underneath the eye, or something more like Lumii, polynucleotides, which is like salmon sperm that gets injected under the eye, in the eye area there, help boost the collagen. Yeah, so it's so many different things. I will also include the different procedures that I offer, like microdermabrasion, you know, the chemical peels, dermaplaning, and all sorts of things like that, hydrofacials, yeah, all sorts of different things. And we've got somebody who does laser treatments here, and then we've got somebody who specialises in different exfoliation techniques. Yeah, so there's a lot of people in the clinic that does a lot of things, and then obviously with your fillers, Botox and things like that, as well as obviously doing extractions and providing medicated treatments to people that need it, and facials, and obviously assessing the skin and then giving you the best things for home. Alright, so anything else you would like to know? Or okay, if you do think of anything, let me know. But what I'm going to do now, love, is just do some extraction, okay? Yeah. Okay, so... okay, so I need to use one of those. Okay. And then one of those for your chin. Now this is going to heat up, okay? Okay. I know it covers your eyes quite a lot, my love. In a moment you'll feel that start to get really warm. Okay. Are you alright? Good. Just need to leave that for a few moments, okay? That's just heating the area. I often do a steam, but with this today I'm just using one of these just to free those a little bit. I'm going to wait another few minutes, okay, and then I'll remove that. Alright, let's take this. How's that? Okay. Now this is still really warm, so I'm going to pop it on your chin, okay? Okay, leave that. Very strange, isn't it? Okay, this will feel a bit cold, my love. This is just going to dry and sanitize this area, okay? So you may feel it going quite tight. Okay, lovely. Just pop this light on. Yeah, I can definitely see all that oil build up. Yeah, that's a lot. Let's have a look at the rest of you. Yeah. Okay. Right. So, let's do a little extraction. I will be using some tools, but I will also be using just my hands, okay? Okay, I'm going to use this one, I think, first. Okay, so I'm just going to pop this here, and I'm going to just some pumping. This is just on one of the big ones. It kind of helps suck it up a little bit. Okay. Is that alright for you? Good. Okay, some of that's come up nicely. Right. So I'm going to start with the larger device. Okay. And I'm just going to press it against different areas on your nose. Okay. Now you will feel a little bit of pressure. Good, well done. Okay, I'm not sure I'm going to get any more out with this. I'll just have a little more go. Yeah, okay. Okay, so some of the others are a lot deeper. So I'm going to use my circular ones, okay. Okay. Okay, now this will feel a bit more intense, okay. Wonderful. Lovely. Alright, doing really, really well. This one's a little bit on the stubborn side. Okay, I'm going to pop it a smaller one. Better. Okay. You're all right. You're good. it does look a little bit red, and you may be feeling a little bit of discomfort now. Okay, so I'm going to move on and get the tissue. Okay, so I'm just going to be doing some squeezing, okay? Alright. Yeah, sometimes I have to use my fingers for a better result. Alright, do really well. Okay. Let me just wipe over that again. I must say your nose looks so much better already. So I've got a lot of the small ones out, come out quite easily. Got a couple of the big ones, and there's still probably a couple more that we could get out, but I'm going to have to try and use another tool. So I'm just going to use this special tool for now. It's supposed to just like exfoliating, but it's to use after the products I've applied. Wonderful. You might have to use tweezers a little bit on that one. I don't really want to do that too, but okay. Nearly. Perfect. It's nearly out, but I just need to tweezer it out, okay? Keep nice and still. Perfect. You did really well, my lovely. Okay. Okay, that's wonderful. Now let's take this off. Yeah, that looks nice and warm. So okay, why not okay, so bring in this one. You alright? Good. These are coming out nicely. definitely recommend you using those strips though, my lovely, okay? Just to help remove any of the others. Okay, I'm going to have to use the other one. Okay. Might feel a lot of pressure with this. Well done. I'm going to have to try the other end, I think. Nearly. Okay, I might have to tweeze that one as well. Wonderful. It's nice and clear now. Just going to check the rest with this. Alright, doing really well. Lovely. Okay. 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 Put this down. Okay. Just a special product here on this gauze. And it's just gonna soak up any oil, any other blackheads, and clean the area as well, okay? And then we want another one for the chin. Feeling alright? Good. Wonderful. So, that's everything I will be doing today. Alright, I will obviously write everything up as I said and send it over to you. Okay, you're very, very welcome. And then, you know, we can go from there. Alright, so, you know, look into some of the products, maybe start some products and go from there, and then we could get you back in and have a look. Alright, but your nose and your chin look lovely now. I can't really remove any more from the nose area at the moment. They're either too deep down and I don't want to give you like any pain. So, you know, try and get those strips, I think, and use that for a little bit. Alright, okay. Now, any other questions? Alright, so leave it with me for a couple of days. I'll send everything over that you need to know, and then we can go from there. You're very welcome. It's lovely to meet you. You take care now. Bye bye.